Hi, welcome to today's episode of my pregnancy journey with Dr. Sikolia. This is our second series on the topic of miscarriage. Does age increase your risk of getting a miscarriage? Yes, because with advancing age, usually there are higher chances that you could miscarry. So we tend to see them commonly in women who are above the age of 40. And the reason for this happening is because the eggs are a bit old because they've been there for a very long time. And so the quality of those eggs are not very good. So when fertilization happens, you find that the baby has abnormalities which will eventually lead to a miscarriage happening. So does the same apply to the man? We do not have enough evidence at the moment to be able to say whether the man's age would contribute to miscarriages, but maybe we could gather more evidence on that. But at the moment, the answer will be no. It doesn't contribute as much as the woman's age. How soon can you conceive after having experienced a miscarriage? There are several factors that will determine that. The first and key thing is your mental well-being, because remember, you've lost a pregnancy that you're looking forward to, and you could actually break down, or it could affect you in a very negative way psychologically. So we advise you to make sure that you've healed from this trauma first before you get pregnant. So that could vary. Some people take longer than others, and there are those who would actually find more comfort in getting pregnant sooner than waiting. So that will actually depend on the individual. So there is no specific time that you put to it. Physically, your body will be ready after a month or so to carry another pregnancy. But remember to also discuss this with your doctor, because it will depend on what caused the miscarriage that you had. So if it happened and we find no reason at all, then you're good to go within 3 months. But if there are specific reasons that we need to address, then we could tell you to wait slightly longer. We address the cause before we allow you now to get pregnant again. We could prevent miscarriage by addressing the cause of what is actually causing that miscarriage. So there are women who would have one miscarriage with other normal pregnancies. In that case, we just reassure them and tell you to try again. But there are those women who have what we call recurrent miscarriage. So you're finding that a woman is having one miscarriage after the other. So the best way to prevent this is, first of all, to identify the cause. So we need to run a couple of tests to know what is causing those miscarriage. And once we discover what is happening, for instance, if you have a clotting disorder, then we treat it. If you have a problem with the antibodies, then we treat it. If you have an issue with the lining of the womb, then we enrich it before you try to conceive. If there is a problem with your cervix, then we address it as soon as you get pregnant. Usually we will put what you call a stitch to try and strengthen your cervix. There are also some medications which we may give you to help prolong the pregnancies, some hormone treatment, what we call progesterone. We can give you that in early pregnancy or before you conceive to try and help the pregnancy to grow in a healthy environment and prolong to term. Depending on the type, there are several ways in which we approach miscarriage and how we treat it. So one, we could do nothing. So we let nature take its course. So especially if it is very early in pregnancy and you are not keen on a lot of intervention, we could just wait. And usually within 2 weeks or so, the body will notice that things are not well and it will expel. And most of the times you will bleed and the entire pregnancy will come out on its own. So the other method, how we go about treatment, is using tablets. So there are some tablets we could give you that will induce labor kind of pain and make the uterus, your womb, to contract and expel the miscarriage. And the third and commonest way to manage a miscarriage is what we call cleaning up. Some will call it DNC. Basically what we do is we'll take you to theater, and then using some very fine plastic tubings, we will insert them through your cervix into the womb, and then we clean out the womb of all the remains of the pregnancies that you had. So those are the three ways in which a miscarriage will be treated. Now, if your miscarriage is recurrent, then just treating is not enough. One of the things we advise you to do, or one of the things that we will do, is we take the remains of your baby, the fetus, for further examination to be able to help us understand why the miscarriage happened. And this will guide us in counseling you and advising you on how to go about your next pregnancy. So miscarriage is a very unfortunate event to happen to any woman who is expecting a pregnancy. But remember that there are ways in which we can be able to prevent them. There are ways in which we can be able to help you treat and prolong your pregnancy to completion or to term. And also remember that I still emphasize on the need of an early pregnancy scan to be able to identify those pregnancies that are at risk of miscarriages, so that we can institute preventive measures before things happen. Thank you for joining us in today's episode. I hope you found it informative, and if you did, please leave your comment below, or you can ask any questions and I will get back to you. Should you require any further in-person consultation, then please feel free to look out for us. Also encourage you to leave your comments, share and like this video, and also remember to subscribe to our series of My Pregnancy Journey with Dr. Sikolia.